Dr. Merlene Fredricks says the H1N1 pandemic has occupied a lot of the ministry's time and effort. She says moving forward, as she assumes the helm of the health ministry, she will be paying particular attention to the prevention and management of non-communicable diseases.
We're starting the new year and we're still in the midst of a pandemic, the first pandemic in a number of years. We have been fortunate in that St. Lucia has not seen the second wave of the H1N1 influenza infection, but we are still being wary of the possibilities for further infection, that more persons can become sick due to the H1N1 virus. But apart from that, we also have the chronic non-communicable diseases like the diabetes and hypertension. I know that many persons are suffering from those diseases, and perhaps all of us have a family member if we ourselves are not affected. So that is definitely, a big one of the priorities for the Ministry of Health.
Dr. Fredricks says as CMO, her duties extend to supervision of the primary healthcare sector. She says she welcomes the opportunity to serve the public in the capacity of Chief Medical Officer.
The Chief Medical Officer is really supposed to be dealing with the primary healthcare, which is like the non-hospital portion of health, and public health. Public health, basically, it's about preventing diseases and taking the necessary precautions rather than waiting for diseases to develop and then reacting to it. So I look forward to the opportunity to serve.
The newly appointed CMO gave an indication of some of the endeavors she intends to pursue in her new role.
Definitely in terms of patient care, this is going to be the priority for me. I'd like to see persons become more aware of their health, of what they need to do to keep themselves healthy. In terms of healthcare workers, I am very interested in training and to ensure that healthcare workers in general, whether it be doctors, nurses, environmental health officers, persons who work in health promotion, the nutritionists, pharmacists, that persons have access to further training while they're on the job.
The Ministry of Health is likely to get revamped under Dr. Fredricks, whose priorities include gaining greater access to funding and to establish links with organizations and groups that can serve as allies in the advancement of the island's health sector. Lovely St. Amy for the HTS News, Channel 4.